I'm Scott Farber of gbctv.net. With me today is Dr. Nadeem Khan, emergency medicine doctor. Tri-Cities Urgent Care is his facility. He also practices medicine at Lake Granbury Medical Center. Well, tell me, it's a very busy time right now with this pandemic going on. What have you been seeing?
So absolutely, we have been seeing a lot of confusion, a lot of different diseases, especially COVID-19. I've seen a few cases of it, and personally involved in taking care of 4 patients actually in the emergency room. And it's kind of scary, and it's here.
So, as a doctor, I know you guys just delve into anything. Has this given you guys a little bit of pause? Do you think a little bit first before you just jump in? You do anything different than if another patient came in the ER?
Absolutely. If there is anybody with COVID-like symptoms or flu-like symptoms even, we have to prepare ahead of time for them. So most of the time, the EMS will warn us if they're coming via EMS. But a lot of time, people just walk into the emergency room, and we do have to wear personal protection gear, which takes a little time. And but we are trying to prepare for the patient in time, and we greet them in a timely fashion and take care of them.
Now, out of the 4 patients with the virus, the coronavirus that you've seen, how were they when they came in? And what I mean by that, were they aware that they might have the virus? How did they take the news?
So one was aware, and he was positive for the test, which was done as an outpatient, and his symptoms got worsened, and he came to the emergency room the day I was on duty, and he was really in a bad shape, and I took care of him.
Mm-hmm.
So
What do you see happening? We've heard so many stories about their lungs having issues. What did you find in the patients you worked on?
the most important and the most dangerous symptom is obviously shortness of breath, and that is scary. The first patient that I saw that was affected by corona, and he was the one that was aware that he had COVID-19, and he was positive. Testing done by his primary care, and it was difficulty in breathing, and it was scary. I can tell you that.
Right, right. And what do you say to their families? How did the families take it?
So the family actually, since they were aware of my first patient, so they knew what was going on, and they knew that this is going to be a life-saving hospital visit here. So they were aware of the what was going on with their loved one.
And now with the coronavirus, has there been a toll on the doctors and the nurses? I mean, is it business as usual, or is it different now?
Absolutely not. It is not business as usual. People are scared, so they're not coming out. A lot of things that we used to see in the emergency room and in the urgent care, our volumes have gone down, our acuity has gone up. People who are really sick are coming to the hospital. Even some patients will call us and say, I think I'm having a heart attack, but I'm not coming to the emergency room. And we have to literally plead them, please come to the emergency room. We're going to take every precaution that we can, and we will take care of you.
So you're telling me people think they're having a heart attack would rather be at home than seeking medical help?
Yes, I had personally talked to a patient on the phone and told them to come to the emergency room because they need to be checked and evaluated by one of the emergency medicine physicians or providers, and they will not come. They're scared of coronavirus, and they will not come out of their house.
Wow. Now you have a family, kids at home too. How, is it different for you? Do you have to quarantine yourself? Are they afraid to be around you? What goes on in a doctor's house?
So a lot goes in a doctor's house. So when I'm dealing with a patient, obviously you concentrate on a patient. You want to save that life, no matter how much your life gets in danger. And to give you an example, my first patient of coronavirus, I could not intubate, and then I intubated him, could not hear anything because the lungs were so fibrosed. If I'm too technical, let me know. They were so full of infection that I could not hear that if the intubation was successful or not. and I was scared. Honestly, I was getting scared, and I want to take off my personal protection and see with my eyes because my glasses were fogging up and everything. So it was scary, but
But what
that
about when you come home though? What precautions do you take? Do they throw you into a quarantine in the house? You personally?
So personally, when I come home, I take my clothes in a different room and keep them as not to spread in the house all the germs and everything, especially the shoes. And after that, I go straight to the shower and then I meet and greet everybody.
Let me ask you, you know, we hear so much about the country reopening now. What does the medical community think about restaurants opening and places of business opening again? How do you guys feel about that? Do you prefer the lockdown or do you prefer life to go on as normal?
So I don't know about other people what they think. I mean, close friends will give me their ideas and everything, but personally, I think this is a very tough time. I think we not need to use this as a political gain and be uniform on our taking care of this disease and the whole process. The economy is going down. Yes, we need to take care of that, but we need to take precautions. Now, my thing for this is if we are opening in an area that are safe, we definitely need to take precautions. People still will think that oh no, there's nothing happened in my area. Yes, it can, and some scientists are thinking that a second wave of coronavirus is coming. So
Has this taught the medical industry anything about preparation for something in the future?
yes, it has, and to be honest, we were not prepared for this virus, and when it suddenly hit us, we were like, oh wow, it's here. I mean, and it's hitting us, and we were not prepared. That's the truth, and we had to quickly make some changes and make some changes very fast and break some rules, and we are being successful, but we are not there 100% yet.
Now, are you finding that the older people are really more susceptible, or is it really just across the board?
No, everybody is susceptible, but I think the older people are getting more out of this virus than the younger, healthy people.
Right.
There are a lot of people that are with diabetes, obese, and in older age, obviously your immunity is low and it affects them.
You know, we just hear so much about all the different things the virus does. Is there a consistency? Excuse me. Is there a consistency to it, or is it different in everybody? Because we hear so many different things, and these people have it and didn't even know it, and these people died, and these people are very sick. I mean, what is it? Is it consistent, or is it just across the board and we don't know?
So, in all honesty, I think we still don't know. It's very early to say anything. What's the pathway for this virus? We don't know how it reacts. We don't know how fast it goes in incubation, what it does, how fast it affects a person. So it's I think it's we are still in beginning stages. Yes, we are making progress, but still there's a lot needs to be learned. It's there's no like anybody is more susceptible or anything. It affects everybody. Now the people with less immunity, older people with comorbidities, they're going to be affected more like any other disease.
Right. And how do you see it through the summer months and through the fall? I mean, what should we be looking for? Are we going to be having school in the fall, do you think? You know, is this going to come back in a bigger wave? What do you think is going to be?
So, like I said, I mean, we don't know about this virus. Usually, like for flu virus, we can safely say, yeah, no, it affects us in the cold weather, in the warm weather, it goes away and everything. But we don't know about this weather. We just, I mean, with this for this virus, it just started last year, and it's been heading up and affecting more and more people. We don't know anything about this. What's the epidemiology of this? How will it affect in the summer times? Now, with the opening of the all the social stuff and everything, restaurants and everything, the people mingling and gathering, I honestly don't know what's going to happen. So we will take our precautions, we'll be cautious, and we'll see.
Doctor, thank you for your time. We're going to check back with you and do this again in a short time and see what's changed.
Thank you very much.
Thanks so much for watching. Please make sure you like and subscribe right here to our YouTube channel. And if you enjoyed, please share with your friends. And if you want to see our collection of thousands of stories told by the people who live them, please head on over to gbctv.net. Thanks so much.